As a breast cancer doctor, I am so happy that we are finally talking about breast cancer risk score on a large scale due to Olivia Munn's recent breast cancer diagnosis. But I want to emphasize the important point that most people who are diagnosed with breast cancer do not have a known family history or genetic mutation or some of the identifiable risk factors that the risk calculator is designed to identify. The two greatest risk factors for developing breast cancer are being female and getting older. So by definition, we are all at risk for breast cancer. Also, your breast cancer risk changes over time as you get older and as more information comes to light, such as family history or interval breast biopsies that might increase your risk. So our breast cancer risk score needs to be part of an ongoing conversation about breast health. Understanding your breast cancer risk is part of it, and also understanding ways that we can lower our breast cancer risk through lifestyle modifications and also medications and surgery in high-risk individuals. But it's important to acknowledge that there are lots of environmental factors that are out of our control, and you can do everything right and still develop breast cancer, which is why I'm a firm believer that early detection is a breast protection. I encourage everyone to stay up to date on their breast cancer screening based on their breast cancer risk. Average risk women should start breast cancer screening at age 40 every year. High-risk individuals need to start earlier. A good rule of thumb is 10 years before a first-degree relative who is diagnosed with breast cancer. But if we know you're high risk based on calculators, we would start MRI as early as age 25, add on an annual mammogram beginning at age 30, ideally alternating every 6 months. It's also important to understand your breast density. So if you have dense breast tissue, heterogeneously dense or extremely dense by mammography, I would consider adding an ultrasound or MRI depending on your risk factors. This allows us to find smaller breast cancers in an earlier, more treatable stage. I also am a huge proponent of the self-breast exam so we can identify young women and even men who are not regularly screened with mammography. Stay safe out there, breasties, and as always, follow the Booby Docs for more of the breast information.